Welcome to the HealthFix Podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. Hey, health junkies. On this episode of the HealthFix Podcast, I'm interviewing Ali Navidi. He is a licensed clinical psychologist and one of the founders of GI Psychology. It's a multi-state center, so they actually can help folks all over the U.S., which is really cool. And he specializes in helping folks with GI disorders and chronic pain overcome their symptoms. And here's the cool thing about this. Most GI conditions that go chronic have a brain and gut connection. So that gut-brain axis that you may have heard me talk about, Ali's working on it in his clinic. And he also has other folks that work with him. It's not just him alone. And here's the cool part of things. He's overseeing the practice. He is helping folks to really understand through cognitive-based therapy and hypnosis how you can overcome your chronic gut issues. So what kind of chronic gut issues are we talking about? I'm talking about food sensitivities. So if you're someone that has like 4 foods you can eat, this is where you want to go. If you have SIBO and you've tried everything to kick it, you want to talk to folks at GI Psychology, because let's face it, the gut is truly your first brain and your brain's your second brain, my opinion. But the truth is if your gut's not happy, your brain's not going to be happy. And so we're going to have a lot of crosstalk here. And what's also fascinating about this is that we can create a lot of the issues for our own selves with our gut. Now, I'm not saying it's all in your head. I'm saying that this is a legit thing that happens, and we can rewire our gut-brain connection. Just like folks are talking about rewiring trauma, rewiring thought process, mindset, all this stuff, you can also rewire what's going on between your gut and your brain. Ali and I dive into all kinds of different things, but one of the things I also want to highlight is that his group is working with kids. So if you've got kiddos that are having gut stuff, and you know that like Sunday night before school starts Monday, the gut stuff starts in, and you're like, oh, not again. This can be incredibly helpful. I can't say enough about this connection, because I truly believe that we have to keep the mind thinking about the nervous system in every health issue, especially the gut. So I'm really excited to introduce you to Ali Navidi. He is a doctor. I should have said that right off the bat, Dr. Ali Navidi. And by the way, GI Psychology, and they're online, but they're also in the DC area. And so he has talked at Georgetown University. He's talked at George Mason University. He's done multiple interviews for TV and whatnot. He is a wealth of information, and the Washington Post even, he has been featured there. A lot of background here, a lot of work on the clinical side of things, and this is a fascinating podcast. So if you're struggling with chronic gut stuff, this is the one you want to listen into. So let's introduce you to Dr. Ali Navidi. Ali Navidi, welcome to the HealthFix Podcast.
Well, I am happy to be here, Jannine, and I'm eager to get started talking about all the nerdy gut-brain stuff that we can handle.
Well, I have no doubt that folks listening are going to be excited, because I haven't talked a ton about nerding out basically on the gut. I talk about it here and there. I talk about his foundation, but you brought up something before you hit record that I think is really fascinating to bring forward, because you'll hear from the functional medicine space and the natural medicine space, gut up. And you mentioned brain down to the gut. And I'm like, you know what? Both work. And they both work in terms of how we're approaching certain clients and certain situations. And in particular, I'm going to bring up a couple cases I've had, and we'll geek out on those as we move through. But in particular, just thinking about like how important just having a connected body is.
Oh, yeah. Yeah. And sometimes my patients are surprised when they find out how much of an effect their brain has on their body. And what I tell them is, hey, look, you've got a brain and you've got a body, but you also have a neck. And that really, it connects the two very powerfully. So I'd love to hear those cases that you're talking about.
Yeah. It's funny. We got a neck, we got a chest, we've got other things in there as well. And one of the cases in particular that comes up, as I knew I was going to be speaking with you, is one in which I will see women in particular, perimenopause, menopause time of life, we tend to feel disconnected or feel like we're a stranger in our own bodies because we've got roller coaster emotions. Sometimes you'll say something and be like, who was that? I don't even know, So someone on my shoulder, what's going on? And in particular, this is also a time when if someone had gut issues previously, things can show back up, or we'll have new gut issues start to show up as hormones flux. And one of my most memorable folks is a gal who was complaining about SIBO, so small intestine bowel overgrowth. And she
Yep.
had done all the things, all the things. And still, we would go back to where's your vagus nerve? Where's your nervous system connection? So I'd love for you to dive into when folks have done all the things for the gut and there's still that nervous system connection where there's that anxiety, there's that I don't feel
Yes.
so good in my body. Let's talk about that.
That's funny that you brought that up because I was also thinking of a patient, Alex, patient's named Alex, and they had gone into the Middle East and then come back with Middle East respiratory virus. I think there's a specialized virus. Anyway, they had all these symptoms and then they blasted him with antibiotics. And then following that, the virus was gone, but he kept having symptoms, kept having problems. And he went to all the right places and did all the right things in terms of standard Western medicine. And he couldn't get any help. And then he found a naturopathic doctor and got maybe like 50% there. And he had developed SIBO over that time, and that was causing a lot of trouble. But that last 50%, he just couldn't get there. And he was crippled. He was really crippled. He couldn't work. He had such discomfort and pain, and essentially what we call functional dyspepsia. So kind of like the upper GI, but responded amazingly to clinical hypnosis and cognitive behavioral therapy, that combination. Within about, I think, 10 sessions, he was symptom free. But it just goes to show you, you got to find the right pieces for the puzzle. And sometimes when you've tried everything else, that last piece is the central nervous system, right? So I absolutely agree with what you said.
I'm glad you say the last piece when we've gone through all the other things is the central nervous system, because I've tried over and over to convey it to a lot of folks. And sometimes I think it just needs to be said by someone else. It's kind of like the mom saying it and we need someone else in the department to say it. Now, when we're looking at cognitive therapy, when we're looking at hypnosis, a lot of folks will be like, man, what are we doing? Like, what's going on? In particular, a lot of folks probably understand on a base level, cognitive, but hypnosis, how does that work for the central nervous system? How are you implementing it? Give us a background there.
I think there's a few things I want to explain so that people get the right context.
Yeah.
So first, let's just talk about what hypnosis is and what it isn't, right? And the problem, I think, with hypnosis is that everybody knows about it. And what they know is entertainment hypnosis, right? They know mind control, they know magic, they know all that wacky stuff. And what they don't know is clinical hypnosis. And clinical hypnosis has, at this point, 40 years of research of using hypnosis on GI problems. And the research is amazing. I mean, we're talking about hundreds of studies, all uniformly effective. And it's a tragedy to me that people don't know about that side of hypnosis, right? Without spending too much time on it, let's just separate all the entertainment stuff and we'll say this clinical hypnosis is a whole other thing. How does it help with the gut? Well, you've already probably taught your audience well that there's a very powerful gut-brain axis, and that what happens in the gut can affect the brain, and what happens in the brain can affect the gut. Well, what we often see in patients with gut issues is something called hypervigilance. And it's this unconscious, anxious scanning of the body and of the gut, particularly if there's a problem area. And the brain is always going there looking for, how's it feeling? I don't know, it doesn't quite feel right. And it's always getting, and when it finds something it doesn't like, then the catastrophizing kicks in. Oh my gosh, I'm not going to be able to go out today. This is a bad day. I shouldn't really try to eat it. So they start catastrophizing, and then all that anxiety and stress get funneled right into the gut. And then the symptoms actually increase. And then all those symptoms feed back up to the brain, and they get amplified and distorted by something called visceral hypersensitivity. So we've got these three components, right? The anxious scanning and catastrophizing, the visceral hypersensitivity, which amplifies it, and the powerful gut-brain connection. And that creates this really nasty cycle that traps a lot of people in symptoms.
I think this happens so often for folks when, especially in chronic gut issues.
Yes. Yeah, on the chronic side, absolutely.
It seems, when I'm looking through them and just scanning through my brain about the different cases I've had, SIBO obviously is the top one in my mind, because I've seen people go through so many different protocols and all the way down to eating nothing and they still have symptoms. And it's like,
Yeah.
I'm guessing you've seen that too.
Oh yeah. We'll often see patients come to us where they essentially have something called ARFID. And I'm sure you're familiar, like avoidant restrictive food intake disorder.
Okay.
Meaning they've systematically reduced their diet to the point where it's negatively affecting their life, it's negatively affecting their health. And the sad thing is they're doing it to either avoid pain or to increase health, but they're getting the opposite effect.
And sadly, I'll admit that I've gone through this in my practice of am I causing more trouble than good with eliminating diets and these kind of things when it comes down to a very chronic case of folks. It's like, ooh, I don't know if we're doing the right thing.
Well, I think also there's a lot of danger when people do these things on their own.
Yes.
So as an example, there's a few different diets out there. One of them is FODMAP. Another example would be like AIP diet. And both of these can be very strict. They're not meant, you're not meant to stay on it. They're elimination diets, meaning you go on it and then you reintroduce things back later. And I don't know that people always do the reintroduction part, because either they don't know they should or they get anxious about reintroducing that food and they're just not able to do it.
I think both are things that I've seen when folks have come to me, and the anxiety around food. I'm sure you've heard this too. Many people will be like, I don't want to eat out. I bring my own food everywhere.
Yes, it is. No, and just that image, you're at a you just imagine everybody, all your friends or family, they're at a restaurant, they're enjoying themselves, they're eating, and then you've got this little sad little sack there, and you don't get to have that same enjoyment. So we'll work with a lot of patients like this, where they've got that central nervous system component. Maybe we often work with naturopaths, and because we don't know SIBO like you all, and we're not able to treat it. That's not our specialty. So you all will be treating the SIBO, and there'll be a certain percentage that need that nervous system component, and so they'll kind of stall out in their progress. And so that we've got a few naturopaths around the country that send those patients to us. And then what you see is they start improving pretty quickly when that's the missing piece. And then after they've desensitized their system, then we work with them on reintroducing the food. Because while they still have this hypervigilant, visceral hypersensitivity kind of spiral happening, it's really hard to reintroduce food, because they're very likely to have a bad reaction to it. Not because the food is bad for them, but because their system is just running hot.
Let's talk about the system running hot, because that's one of the things a lot of folks, it's hard to tease out, because you associate the food being the problem.
Right.
And it's hard to be like, wait, no, it's my nervous system. So how do you work with the cognitive, like CBT, and how do you work with different, I guess not the quick, but the hot terms, rewiring the brain per se. And I don't know if you use that term. I'm curious as to what your term would be for helping someone in this case and having these reactions.
Well, an example, one thing you want to educate them on is this phenomena called conditioned food sensitivity. And most patients that are in this situation don't even know that's a thing. They know about food sensitivity. They know, I eat this food and bad things happen. But they don't know that there's a percentage of that can be conditioned. That's nervous system based. The symptoms are still real. The reaction in the gut or the reaction in the body, 100% real. But the cause is not because the food is not getting along with the body. The cause is that their nervous system has conditioned them. So how could that happen? An example, let's say someone is just having a bad day. Maybe they're stressed out. Maybe their system isn't just feeling good that day, and they happen to eat pizza. and they have a bad reaction. So then there's a part of their brain that's going to be like, pizza, I don't know about you. And then the next time they eat pizza, that part of their brain is going to pop up again and going to be like, I remember what happened last time we ate pizza. And there's going to be this increased hypervigilance. And then if anything starts feeling weird in the gut, catastrophizing. Oh man, I knew it. I knew I shouldn't have eaten that pizza. See, I'm going to have a bad day. My gut's going to give me trouble. And at that point, all that stress and anxiety feed down to the gut, and it's a self-fulfilling prophecy. And now they're sure that pizza is bad for them. And every time they have that experience, it reinforces itself until that reaction is essentially automatic.
Makes sense. That makes sense. Man, so how do you undo that? What's the story on undoing that?
So we get back to our buddies, cognitive behavioral therapy and clinical hypnosis. And by the way, cognitive behavioral therapy is fairly well known. What we're talking about here is a very specific type and a very specific protocol within it. So if you just go out into your community and just pick a random CBT therapist, it's very likely they won't know what to do with a GI problem. I just want to put that warning out because I've seen that happen very frequently. So you're going to use that cognitive behavioral therapy to reduce and change that hypervigilance and that catastrophizing. You're going to teach the brain how to think and react in new ways. That's not just an intellectual thing, that's also just an experiential thing. And then that's where clinical hypnosis, it's a tool that can do so many different things. But one of the things it does that I don't really know of a better way to do it is it can directly reduce the visceral hypersensitivity. And that's a really powerful thing because the sensations from these people's guts are not actually bad. It's just that the brain has learned to amplify and distort them. It's kind of like the metaphor I use is if you're listening to music, and you got headphones on, and as a joke, someone goes and like cranks the volume up really high. It's not like the music's bad. It's just the volume has been cranked up really high, so you're not going to enjoy it. In fact, it's going to be painful. And that's kind of what happens to sensations in the gut.
Wow. A lot of people right now might be thinking like, okay, is hypnosis then maybe reducing histamines? Or is it maybe reducing, adjusting serotonin and dopamine, neurochemical GABA? Are there any studies that highlight the neurochemical effect? Just out of curiosity, and it's more asking on the studies, like just so I can relay things to folks. Or anything?
Yeah, it's a great question. And I'm more ignorant than I should be about the biochemical effects. I know, as an example, I remember reading one study, it was out of Italy, and they were using hypnosis. And they actually found that after the hypnosis, they saw epigenetic effects and also reduction of immune response. Yeah, and I was like, oh my gosh. And they've done brain studies also. I'm a clinical guy and I just like to treat the patients, but there's a lot of studies out there looking at, fMRI and different things like that. It's one of those things where it's surprisingly well studied. If you go into something like PubMed and just type hypnosis in, you'll get thousands of research articles studying hypnosis. Yeah. So, but I don't want to make anything up. But the research is out there. It's just, I'm not the man who knows it.
You're fine. I asked just because a lot of people might be interested, but me, I'm always like, where can I geek out more? Right? Where can I geek out more?
Yeah.
Now, of course, I usually start podcasts off with this question, but I'm going to throw it in now just for fun. What brought you to really looking at the gut-brain axis and all of this? What was going on in your world when you're like, there's something here?
Actually, I fell backwards into it. I was a microbiology major. I was working in biotech, and I just started reading more and more about psychology, about hypnosis, and I loved it, but I never actually put it together that I could do that for a profession. I was going to be, about to start a PhD in biochemistry. And luckily my wife was like, you might want to actually do something you are passionate about. I was like, okay, well, yeah, yes, best advice I've ever gotten in my life. Right. So then I switched gears and, long story short, I've got my own practice. I'm using hypnosis all the time. I'm using CBT all the time. And I didn't know it when I first started, but like I mentioned before, hypnosis is an amazing tool for GI problems. And so I started with one patient and got great results, and then did it with another, and then their doctors found out and they started referring to me. And it was just, I think, basically a need thing. There just wasn't anyone else in the area doing this kind of work. And I was the only one there doing it. So slowly, it was like eventually 80% of the patients I was seeing became GI patients because there were so many of them and there was nowhere else to go. And that's actually why I started GI psychology, why myself and another psychologist started it. Because it was frustrating and sad to know that, like once I was full, there wasn't anyone else in the DC metro area who could help these types of patients. And I thought that was crazy. And so we started this practice and we've grown very quickly since.
I can imagine. I mean, second to fatigue, gut issues are the number 2 thing that folks see me for. Then, of course, hormonal is in there, in the mix too. And right now, I mean, it is hard to find folks that are specialized, right? And of course, I want to highlight, I of course had to ask him, like, really, you can see people in every state. So guys, I like to see people in every state. And so tell us a little bit of how that works and like what a typical session with you is like, so folks can get a sense, because I think for many people, they've had therapy before and it's just straight up talk based. And so they might be like, okay, when does hypnosis come in? When does CBT come? How do you do it? How does it work?
So this isn't your everyday regular therapy. This isn't what I would describe as supportive therapy. Not that the therapist isn't supportive and kind and nice, but the goal is very focused and it's very skills based and it's very problem focused. So you're going to learn specific techniques. You're going to learn skills in terms of how to use hypnosis, how to use cognitive behavioral therapy to break that cycle that I described earlier, to break that hypervigilant, visceral hypersensitivity cycle. And for that reason, it's probably a little different than just the talk-based. There's a lot more of an experiential component, right? Because people can talk all they want about, this idea and that idea, but to have the experience of what it's like to use hypnosis, to go into trance, to use that trance to turn down the visceral hypersensitivity. So they could go in one session from, let's say, an 8 out of 10 pain to like a 2 and see that happening, have the experience of it in 15 minutes.
Wow.
It's something you just have to do rather than talk about.
Right. And I think for a lot of people, they're like, okay, you can do this telehealth, obviously, because you're in all the states. And when you're talking through things, you're doing the trance state of the hypnosis. The person is, like you said, talking down the pain, like literally working through the area or visualizing the area, something of that nature, depending on what you've prompted them, of course, with the hypnosis.
Yeah. So hypnosis really is actually kind of simple. All it is teaching someone how to, on purpose, go into a trance state. And a trance state is a normal human state of consciousness. We all go in and out of trance, when we're driving our car, when we're watching a movie, when we're exercising. It's hard to keep people out of trance. It's very common. I always make, what's that?
I'm like, really? So we're all walking around in a trance, and it's in a lot of ways on autopilot.
Oh, yeah. I mean, just think like you're in a meeting at work and your mind wanders and you're thinking about what you're going to do later. And then you're thinking about, okay, I need to go shopping. I need to get this, that, and the other thing. And then you come back and you're like, what the hell were they just talking about? So you think about it. Your ears were working. Your ears were receiving those sound waves, but your brain was somewhere else. That's an example of trance. I always make the joke, because I've got teenagers, if you want to see what trance looks like, just hand a teenager their phone. They're going to be gone.
Mm-hmm. Yeah, you're absolutely right. I mean, just scrolling on social media is trance state. And driving, of course, I think a lot of folks can relate to that, where you drive home from work, same path a million times over, and you're like, oh, look, I'm home already. What even happened on the way home?
Yeah. I've got my book on tape playing.
Right.
Suddenly I'm home. I'm like, okay.
Yeah, here I am. Here I am. And I don't think a lot of people realize that during these states, and I'm very curious too, if you recommend homework and folks to do some exercises that maybe they could tap into the drive home from work, working on their pain. I don't know. Just throwing it out there. Give us a little background on like what kind of homework do you provide for folks?
So there's two types of homework we really almost always give. One is when we do the hypnosis session, we're going to record it. And then we're going to want the person to listen to it and practice it every day between, that time and then the next appointment. Because we're rewiring the brain. Doing it once is good. Doing it 3, 4, 5, 6, 7 times is just going to, reinforce that new pathway in the brain. The other thing we teach, which is really powerful, is something called an anchor. An anchor is so simple, but just such an empowering thing to learn. All it is conditioning. So, we see like a sign, a commercial for our favorite food. We suddenly get hungry, we see a certain person that we don't like. We just see their face and we're a little annoyed, right? These are all different kinds of anchors. And so we create a relaxation, or we create a comfort anchor, or we create an anchor for managing their pain. But we create it in a conditioned response so that they can do the anchor whenever they need that effect. If they need more confidence, you can have an anchor for that. If you need to just relax and chill out, you can have an anchor for that. A patient I just started working with recently came back and said, I've been using my anchor like at work, and it's just, she's so happy about it because she'll have a meeting, it's about to start, she does her anchor, and muscles she didn't even realize were tense just immediately and automatically start relaxing.
That's neat. And I can see where that would be really useful for folks who have like spastic kind of gut, like colons and all kinds of abdominal muscles and things of that nature.
Because they need to access that state fast. They can't go off and see me. They probably don't even have time to go and listen to the recording. They need that help right now. And so you create these anchors that can get whatever that effect is and have it happen immediately.
And then you can practice it. And then eventually symptoms kind of just fade away from there.
Yeah. Yeah, it's interesting. What you see is when people respond, let's say this is their symptoms, and it starts to like kind of destabilize, and then it goes, and it's kind of trending down. And then it hits some point where it just, boom, the system breaks and you reset to a new way of doing things.
It's just what people describe like rewiring, your thought against trauma or whatever,
Yep.
other things too. How long on average do you see it take someone if say they're doing the homework, they're doing the things, they're getting their anchors, practicing them, doing all that?
Our data from our practice and also the data from all the studies that have been done is that we want to do at least 8 sessions, and probably on average it's going to be between 8 and 12. People will often start seeing improvement by like the 4th or the 5th session, but the research shows that you want to finish off and do probably at least 8, because that kind of, they start to improve, but what kind of really burns it into the brain are those last few sessions that make it so that the changes last. So, because when the treatment is done, these patients actually tend to keep getting better, which is really interesting.
I like this because it's been that thing that I talk about a lot for folks when it comes down to, like you said, and we said earlier, is like the missing link. And I think that it's a missing link not only for the gut, I think it's a missing link for a lot of chronic illness.
Yeah, you're opening a whole other topic, which is dear to my heart, but you're absolutely right. Yes. There's a lot happening in just the body where there's that brain-body connection also.
Now, I know you focus on the GI. Do you ever dabble in the other space when people have worked with you and they're like, my GI side of things is better, but my chronic fatigue hasn't gone away, or my chronic mono, or my chronic, you name it?
100%. Like all my career, I would always get the patients that had kind of reached the end of the line. meaning, they've been everywhere, they've done everything, and nothing seemed to help. And you almost never see someone with just GI problems. What you often see is this kind of constellation of issues. So you'll often see a GI issue, you'll see headaches, and then there'll often be some kind of musculoskeletal pain that's also happening. And there also might be an anxiety disorder of some kind, or depression or trauma. It's like this very common constellation. And the good news is they're all treatable. It might feel like these are all different things, but there's kind of this common central nervous system theme that goes throughout all of them.
Have you dabbled in I'm guessing you probably have, or some form of this is like the cell danger response and the work around vagus nerve and all of that as it relates to immune system and response?
Yeah. Oh my gosh. It's good timing you asking me this. I just had the most fascinating conversation with this guy that invented a vagus nerve stimulation device that was non-invasive. And it was literally yesterday, and he just kind of blew my mind. I mean, I thought I was already pretty knowledgeable about the vagus nerve and the nervous system and, all this stuff, ventral vagal, dorsal vagal, but he took it to a whole other level, super impressive. And that connection between the vagus nerve and the immune system, I was not very familiar with previous to this conversation.
Yeah.
It was really neat.
It's something. And I'm seeing a lot more folks with, they just keep getting sick over and over again. They can't seem to shake bugs, whether it's chronic mono, Lyme.
Yes.
And it's fascinating to me. But nevertheless, it's something that I always want to touch on a little bit and be like, there's so much more. So are you going to be implementing some vagus nerve stimulators in the clinic and having folks?
Yeah. So my step, like something like this, I'm very willing to test it on myself. Oh, yeah. So that's going to be my first round. They were nice enough they're sending me one of the devices. So I'm like, okay, like I'm going to start doing it every day. Let's see what happens, And I'm so excited to try it. I don't know. Have you already tried devices like that? You have?
Yeah. I've tried the Pulsetto. I've also tried one from a fellow named Mark Fox. He owns, it's Resona Health. He has one that they just came out with. And I've kind of beta tested red light therapy with some tapping on acupuncture points, because there's a company called Kinian. They're coming out with one that goes with red light therapy. And so those have been like my 3 I've been playing with over the last 6-ish months now.
I've also heard really interesting things about red light therapy also.
Super cool stuff. And, a lot of them are panels, right? But if you've got the targeted little red lights, kind of like Kinney, and yes, I have an affiliate with them, folks, full disclosure, but I like the device. But I like it because it's small and you can put it over points, targeted points. So I use it like acupuncture, and you can put it over the belly points. You can put it, neck, you can put it, it's awesome
this whole area is like, this is outside of my zone of expertise, but I'm fascinated by it and it's so neat. I really love this stuff. And absolutely. So if I try it out, and I'm also going to review the research, because he was telling me there's a lot of good research. And so I'm going to check that out also. And if it all lines up, I will absolutely be recommending it to patients. I think I'd be crazy not to if it was even half as good as what he was describing.
Yeah, definitely play with it. You're like me, you got to try it on yourself first. I won't recommend anything unless I've tried it on myself. And yeah, that stuff, PEMF, also pulsed electromagnetic frequencies.
Ooh.
Also another
fancy.
Game. Yes. There's the big beamer mats, and those are like 10 grand, but there's a portable device. Mark Fox, who owns Resona Health, has the little stimulators, but the PEMF, that too is very interesting. It's very, very interesting, and something that, something to look into. We'll get you connected with his stuff too, because I think we're at a place in health where the guts are just going to keep getting more and more inflamed. One of the things I think a lot of folks are going to ask me to ask you, and I'm going to do it now before I get that asked later.
Yeah.
Is, Allie, do you believe that folks could technically eat anything and not have a reaction to it if they worked on the top-down approach to central nervous system and gut? Do you think that folks could be completely reaction-free, even eating like the junkiest of the junk out there?
I'll give you the worst answer anyone ever gives to these kind of questions, and then I'll talk more about it.
Sounds good.
The answer I would give is it depends, right? Because from what I've seen, I do believe there are biologically based food sensitivities. Obviously, there's things like celiac and, different things like that. So I think different, and then just I think, and I don't understand this, and I don't know that science has caught up to this yet, but I think just genetically, there's probably an ideal diet out there for each of us based on our genetics, our biochemistry, that we're just not sophisticated enough to understand yet, all the nuances and the personalization of it. So I would say, like, big picture, I think there's always going to be foods that are better for people and worse for people. What I would say is that if you're somebody who has a history of GI issues, it's very likely that you've picked up along the way some conditioned food sensitivity. And it's worth your time to try to decondition that, to calm the system down. And I think that can vastly expand the amount of food that some people eat. Because I think we were talking about this off camera, I believe, that some patients will come in just incredibly restricted in terms of their food. Like they could give you a piece of paper that has all the foods they're allowed to eat, right?
Mm-hmm.
And that is scary, getting to the point where they have ARFID, like avoidant restrictive food intake disorder. So it's reached the level of an eating disorder. So I think, and I talked about this with you already, is that you gotta cool down the system and then you can reintroduce. And so for people who have that question, I think the first step is you work with the nervous system, you work with a gut brain therapist, or you do something to calm that system down. And then you can see about systematically, carefully reintroducing foods. Sorry.
No, that makes perfect sense. I know a lot of people out there will definitely wonder, like, can I really eat anything? And of course, I'm gonna always bring the caveat of like, well, if you go to Kentucky Fried Chicken and you overeat it, you're probably not gonna feel great anyway. There are logical situations, and there are, things where we've gotten to the point where, yeah, you're eating 3 foods and that's all you can eat. Now we've got something else behind all of it. And
I think I had a patient, because we see kids also, we see, kids, adolescents. I think there was a kid who was having a reaction to water. At that point, you can be 100% sure that this is a nervous system thing. Because I don't know that it's possible to have an issue with waters, considering what percentage of us is water, right?
It's true. The only thing I would have in my mind is, unless it's really toxic water, then if they live in Flint, Michigan, probably possible.
Right. Oh,
joking aside.
That's sad.
Yeah. All joking aside, like, yes, it would probably have to be some kind of toxic water, but like the truth is like, yeah, that would sound very similar to that. It's good to know that you work with kiddos, because that is a common complaint that I do get from parents, though. Like, my kid does not eat anything. They say their stomach hurts with everything.
Yeah.
And I've also gotten cases where we've had teenagers where I think anxiety's manifesting and we're getting acid reflux, we're getting cyclical vomiting kind of stuff.
Yeah, we get those kiddos, we get those teenagers all the time. I just got done. Well, I'm not done, but he made a lot of progress. A little guy, 13 years old, tremendous amount of stomach pain, clearly related to anxiety, very quickly reducing all the food that he would eat to the point where it was really scaring people, but responded. I mean, and that's the nice thing about kids too, is they can have some pretty bad symptoms in terms of nervous system, gut problems, but they respond really well to treatment, better than adults. Their nervous system can reset and can learn faster than adults can. So you see, like, this guy, he did 2 sessions and he's almost back to normal again.
Nice. That's huge. So if parents see like a shift in the child's eating, based on maybe some stress or whatever it may be. Maybe there's
Yeah.
something with school. We always blame it on, the kids got the stomach aches because they don't want to go to school. But
Right.
maybe something did happen, and we can work on that. So fast,
Yeah.
2 sessions.
Oh, yeah. I mean, people have the capacity to learn. And I think I get a bit preachy when I start talking about hypnosis because it's so misunderstood
Yeah.
and it's so incredibly powerful. I almost think of it as this is almost your right as a human to learn these skills because we all have the ability to go into trance, but most of us do not know how to use it in a productive way, which is sad because, self-hypnosis is an amazing tool for anxiety. It's an amazing tool for pain and discomfort or for using it for habit change. It's a really nice skill to have that sadly most people will never learn.
Well, hopefully they're listening to this podcast and we will get that word out. Now, of course, that being said, folks can reach you at gipsychology.com, but where else? Give us kind of the background in terms of all the ways folks can interact with you, how to get in touch for a session, what it looks like, all that kind of stuff.
Yeah. So we're, I think, on the major, like Instagram, they can go to that website and they can get a free consult. So if they're skeptical about it, they have a lot of questions, they can go, there's somebody clinically trained who will answer all their questions and help them figure out if this is the right kind of thing for them.
That's huge. That's huge. And like we had mentioned before, you're all across the US. What about Canada? What about, international folks? Do you have any resources for them? Things of that nature?
We were just talking about this the other day because I was at a conference and I met a Canadian dietitian and she was saying they just don't have these gut-brain therapy resources in their country. And we've looked into trying to treat patients in Canada and it's like this licensure nightmare. And so we're like, okay, what do we do about that? And then we started thinking like, okay, because we've been around for about 5 years and I've been in charge of training. And during that time, I've taken what was a very informal process of me training the therapist to a very structured, we have like a very structured curriculum that has, videos and things to read and then individual supervision and group consultation and experiential exercise. It's a whole like very solid thing. And so we started talking about the idea of at the very least maybe we can offer that training to clinicians in Canada. If even if we can't treat patients there, that maybe we could train people to do it because a big part of our mission is that it's a very sad situation that these very effective treatments are not available to more people. And I didn't mention this earlier, but when you look at the research, about 80% of patients will reach their treatment goals when they engage in these treatments. So they're very effective, they're short term, and they've got a lot of empirical evidence supporting them.
And I really do hope that you guys do take advantage of Allie's group's free consult to see if it's a fit for you because like you said, it sounds pretty fast, especially for the kids, which I know for a lot of parents that's a big frustration for them. And in my mind I'm like, why wouldn't you?
Yeah, and it happens so often with those poor kids, and the parents see it, they know it. They're like, okay, little Johnny, little Susie is their stomach is hurting every Sunday night or it's hurting every Monday morning. Before they go to school, they're having all these symptoms. They know that there's a brain gut component, but they don't know what to do about it. So, they'll go to their doctor, they'll do all the tests, and the tests are going to show that there's nothing wrong. And then they're kind of like, oh, take them to a therapist. But a standard therapist isn't really going to know how to address the GI issue. If there's an anxiety disorder, they can help. If there's depression, they can help. But they don't know how to address that mind-body connection. And so they really end up spinning their wheels for a long time until they find the right provider. And again, so that's kind of the motivation that we had for creating the practice is, we don't want people to suffer longer than they need to.
Absolutely. No, this is great. And Ali, I've learned so much. We'll make sure we get out your links and we get out the website, gipsychology.com on the podcast notes at Dr. J. Krause, ND healthfix.com. Allie, thanks again. I really appreciate it. Great conversation. Look forward to hearing how things develop with the vagus nerve stimulators and the red light in the practice.
Yeah, I'm super excited. And all of you listeners, you should listen to Dr. Krause. She knows what she's talking about. You know, when she tells you about the brain gut, she absolutely knows her stuff.
You're the best. Thank you so much.
Thanks.
Hey, fellow health junkie. Thanks for listening to the HealthFix Podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.